Hello, my name is Bridget Surratt, and this is CPRC's discussion on cannabinoids and cancer. First thing we should tell you is we are not doctors, and this is not medical advice. The presentation is basically a compilation of just research and anecdotal evidence that we've seen. We also probably should tell you that no human trials exist to positively claim that cannabis cures cancers. However, just make a note that phase 2 trials for glioblastoma multiforme have been promising, and that's through GW Pharmaceuticals. And so those have taken place, and they've had good results with glioblastoma. So while no human trials exist right now, that is changing. Also know that most cancer patients ultimately choose to use cannabis as a co-therapy along with pharmaceuticals. While some do choose to use it as a standalone therapy, that's not the majority of how it's being used right now. So the first thing that you're going to do once you get diagnosed, you're going to talk to your doctor and do your research. And what I want to mention right now is you can't expect your regular physicians to understand how cannabis works with regard to cancer, nor can you expect them to understand much about the endocannabinoid system. So understand this may be a process where both you and your doctor are learning at the same time, but you as the patient are your own advocate, and it is your responsibility to learn these things. And then inform your doctor. And so what this presentation should do is give you a starting point, definitely not a finishing point, but a starting point that you can, of information that you can take back to your doctor so you can design a treatment plan with your healthcare team. Understand that cannabis is like any other medication and should be treated like any other therapy. It's not guaranteed. There are some people that use it and have excellent results. There are some people that use it and it doesn't work at all. And every case is individual, and you have to understand you have the same risks of it not working as you do with chemotherapy or radiation. So then you're going to find a trusted supplier who you can make sure you have consistent access to this cannabis. You want to make sure that your caregiver grows organic cannabis that is not filled with mold and other things, and you want to be sure that you are getting exactly what you need. Understand the dosing for cancer is very high, and you are going to need to have large amounts of cannabis if you're using this, especially if you're using it as a standalone therapy. The protocol, and we'll go over that later, is a gram a day, and that's just a minimum, and that's even flawed in itself. So the second thing, or the next thing that you're going to want to know, is you're going to build up to the desired treatment dose. You're not going to start off with the full treatment at once. As you know, cannabis is incredibly psychoactive, and it does take time to build up to a dose to where your body can handle it. You will need the full spectrum of cannabinoids and terpenes, not just CBD and not just THC. You're going to need all that good stuff like CBG, THCV, CBDA, et cetera, et cetera. There are hundreds of them. I can't name them all. So, and then also know that each cancer has a different treatment protocol when it comes to using cannabis. And so you're going to want to connect with patients who have your specific type of cancer, who are using cannabis to help treat it, and find out what they're doing and the results that they've had. Cannabis Oil Success Stories is one of the best Facebook groups when it comes to connecting with patients. So there are two ways you can use cannabis when it comes to cancer. There's direct disease action and symptom management. And for direct disease action, we'll go over the mechanisms that cannabis uses to actually kill the cancer. And at this point, I do want to mention that both CBD and THC are orphan drug approved to treat glioblastoma multiforme by the FDA. So they do have FDA approval in that manner. So for direct disease action, cannabis causes apoptosis, it inhibits angiogenesis, it prevents the proliferation, it increases Jun D protein specifically, and it helps turn off DNA synthesis. And CBD does that as well. So in cannabis, unlike chemotherapy and radiation, it will selectively target unhealthy cells and leave your healthy cells untouched. No pharmaceutical or medical treatment has that ability as of now. Cannabis is the only one that can distinguish between a healthy and unhealthy cell. So for symptom management, which is the most common use of cannabis in cancer, people use it mostly for pain, nausea, spasms, appetite stimulant, anxiety, and depression. So what's apoptosis? Apoptosis is a programmed cell death. In cancer cells, they do not perform cell death or cell suicide normally, if at all, and they end up forming tumors. And so getting those cells to turn that apoptosis mechanism on, to go, oh, I'm an unhealthy cell, I need to go ahead and commit suicide, is essential in disintegrating tumors. That does, however, cause a lot of necrotic material to build up, and you get that with any kind of treatment for cancer. It doesn't matter what you do. So know that when you have cell apoptosis, you're going to have a lot of necrotic material pop up, and you could have exit wounds for that material. Generally, it comes out the bowels. You can throw it up, you can breathe it out, but you can also it comes out your skin and things like that. And there are other treatments that you can use to help with that as well. So angiogenesis. The angiogenesis is really the creation of new blood vessels within the tumor. And cannabis goes in and it stops that angiogenesis. It stops the creation of new blood vessels. This is critical for tumor development because this is how tumors eat and how tumors get their nutrition. So if you can stop the angiogenesis, you can stop the tumor growth. And for any tumor to grow beyond 4 millimeters, I think it is, they have to have a very good network of food or blood vessels to feed it. Otherwise, it just can't grow. So this is also critical in stopping tumor growth. Cannabinoids have been shown in vivo to inhibit tumor angiogenesis by cutting off the blood supply. So anti-proliferation. As you know, if you have cancer or are taking chemotherapy, using radiation, the goal is to kill more cancer faster than it spreads. But what if you could actually control the spreading while killing the cancer? Cannabis can help with that. Controlling the spread of cancer is crucial because it allows the THC and it allows the chemotherapy to go in there and do its job while the cancer is not spreading. And so that gives you a better chance of being able to treat what you need to be able to treat and killing tumors. So cannabinoids have been shown to control cancer cell reproduction, and they are especially effective, according to Aunt Zelda's, in cancers that have high ID1 gene expression, which is the gene expression for proliferation. So different cancers. Know that each cancer is unique and it does require personal attention and its own unique care plan. There is no one-size-fits-all treatment for anybody. Skin cancer is treated very differently than prostate cancer, which is treated very differently than breast cancer. So you have to know what you're dealing with and you have to understand that and connect with those patients. Since we don't have the science and we don't have the research and we don't have all of that stuff, the best thing that you can do is connect with other patients using cannabis successfully so that you know what they do. And learn from other people's mistakes as well, because they are happy to tell you what they did wrong. Know that pediatric cancers may actually require much higher dosing. So while a lot of dosing is based on weight, we're starting to see that pediatric cancers, despite the fact that there is less weight involved, may actually require higher dosing. And this information is coming out of Arizona from Aunt Zelda's. So just be mindful of the fact that if you are treating a pediatric cancer patient and nothing seems to be happening, try upping that dose and see what happens. Also, know that estrogen-driven cancers may require higher ratios of CBD, like a 1-to-1 at minimum, and maybe even up to 8-to-1, depending on the stage of the cancer. There is some talk out there about THC actually proliferating estrogen-driven cancers, but there's not a lot of science out there about that. So again, just connect with other patients. I've seen patients with estrogen-driven cancers use THC successfully, and I've seen it not be successful. So it just depends. You need to get out there and do the research for yourself and make those decisions. And again, cannabis oil success stories. If you go in there, join the group, search the group for your specific kind of cancer, you'll come up with all sorts of threads and feed, and patients will tell you what they do, and you can comment on them, and generally the original poster will talk to you. So also know it takes time to see the results. This is not an instant thing, so be patient. And if you're having trouble with the psychoactivity, a choline, straight choline, not acetylcholine, just regular choline, can help mitigate the psychoactivity if undesired. You want to avoid acetylcholine specifically because if you're taking chemotherapy, it can interact with what that's doing because it works on that pathway. But a regular choline supplement, which can be bought at any health food store, that should work just fine. You take a couple of those. And also within the next year or so, we're going to see a product coming out called Undo, UNDOO, and it's olivethal, a plant form of olivethal that tends to help mitigate any negative side effects from THC. All right, dosing. The standard dosing that you're going to see online is 1 gram daily for 60 days, but that can be incredibly flawed. You don't know how many milligrams that 1 gram has, and you want to be consistent with your dosing because you want to know what's working and what's not working. And if you don't have consistency, you can't do that. So do a little bit of research. It's better to actually know what dosing you're taking so that you can keep track of how you're doing and you know what to fix when it comes up rather than having to guess. Know that you're going to need multiple delivery methods to achieve high dosing. There's everything from suppositories to edible dosing to inhaled dosing to topical dosing. So you're going to use multiple delivery methods to achieve this kind of dosing. You're going to also work up to the dose you need, as I mentioned before, because the psychoactivity can be intense. Even if you're a heavy smoker or one of those folks who can do a 2 gram bong rip, edibles metabolize very differently. It's apples and oranges as far as that goes, which, apples and oranges are both fruit, but they are very different things. So know that you can still have sensitivity to the psychoactivity with edibles, despite the fact that you use on a regular basis, especially if you only use inhaled. So, and then work with your doctor and your caregiver to find the appropriate dosing and methodology for your individual cancer. This is going to be a team effort, and be sure you include the entire team in it. So for symptom management, these are basically broken down into each different symptom that, or the most common symptoms that cancer patients will use cannabis to help mitigate. And the modalities, which specific cannabinoids have been shown to be the most effective. They'll understand you are different. While it says THCA or THC, CBN, and CBD and CBG are good for pain, they may not be for you. I find CBD actually increases my pain. So you are an individual, and it's okay if this doesn't work for you and you have to go into something else, and if something I don't mention works for you. So know that there's much more than that, but these are just a basic list. All right, so for pain, you see the modalities, FECO edibles, inhaled concentrates, topicals. You think of edibles and ingested things more like extended release medication. It lasts longer, it's going to be stronger, and then inhaled, if you use that, it's going to be more like a immediate release. It's going to help immediately, but it's going to be less strong and it's going to be gone quicker. So you can use the inhaled while you're waiting for your edibles to take effect if you have some serious pain, and topicals for any type of like muscular pains, nerve pain, spasms, and things like that. pain cannabinoids, THC, CBN, CBD, and CBG. And I find that CBN paired with the terpenes below, for me, the beta-caryophyllene and the linalool-myrcene, have been a win-win combination. I have autoimmune diseases where they eat the bone away. It's very similar to bone cancer pain. Specifically, and I find I don't need opiates now. I used to be on 60 milligrams of oxymorphone and 30 milligrams of oxycodone every day, and I no longer need that. So nausea. Nausea is a huge symptom, especially if you're taking chemotherapy or doing radiation, and you have a lot of that necrotic tissue trying to come out. That's kind of a common symptom with cancer. Just in general. So a lot of folks use inhaled forms of cannabis for acute management, because if you're nauseous, especially if you're chemotherapy nauseous, which I have been before, there's no way you're keeping anything down. But once you use enough inhaled to where you can keep something down, it's good to eat an edible, even if it's a low dose edible, just so you have that long-term support in there. So as soon as you can get that edible in there, do it, and just use the inhaled until you don't have to. A lot of the cannabinoids for nausea, THC, CBD, and THCV. THCV is found in strains from South Africa. Not South Africa, the country, but Southern Africa, as far as Sub-Saharan Africa is probably what I should say. But like the Durbans especially have those. And terpenes, menthol, like mint, and know that you can get these terpenes in things that are not just cannabis, which is why I mentioned them separately. So if you have cannabis, but you don't have cannabis that is minty or cannabis that is lemony, and you have nausea, you can, smell a lemon or get some lemon, lemonade or something like that, and that will help as well. Mint, the same thing. Spasms. I found cannabis to be spectacular for spasms. So again, the modalities, you have your topicals, your FECO, your edibles, and your strong inhaled. And for me specifically, I found the topicals to work the best for the spasms. There's your cannabinoids. You have CBN, THC, CBD, CBC, and CBD. And CBC is very hard to find. CBN is rather easy to find. It's degraded THC. And that you can even harvest for CBN. You let your trichomes turn a little more amber than normal. And so that'll give you a little heavier effect. So in the terpenes that for spasms are basically the same ones for pain. So appetite stimulant. This was hard to find information on with regard to cannabis and cancer specifically. But inhaled tends to be the most common use as an appetite stimulant. Then you do have FECO and edibles. But with FECO and edibles, the munchies don't necessarily come. So it's inhaled, you're having lower doses of those cannabinoids. So it's probably the lower doses of those cannabinoids that cause that stimulus. So THC, THCV, CBD, and CBG are all implicated in increasing appetite. And for terpenes, again, I couldn't really find anything. I even asked several doTERRA reps and whatnot, and there was not much that they found. Citrus and minty, though, generally tend to be the ones that will help you with your appetite. So, and lastly, anxiety and depression. Anytime that you're sick, you're going to have anxiety and you're going to be depressed at times because it's miserable. We know. We get it. We're patients. It's hard and people don't understand and life goes on and it seems like no one cares. So anxiety and depression are some symptoms that are treated with cannabis. There's the modality. It's all forms. A lot of people use CBD, THC, THCA, and CBN to treat anxiety and depression. The other thing that I've noticed, as far as cannabinoids go, the higher levels of THC can treat depression a little better. I noticed that most people generally tend to use high THC strains, but you may be different. So be sure to experiment with that. And then the terpenes, as much as it sounds counterproductive to use uplifting terpenes like citrus and pinene, for anxiety, people respond well to them. A lot of folks use sativas to treat anxiety, and that seems counterproductive, but it actually seems to work well. It's the same premise of Ritalin with kids. And then the terpene to calm is going to be like linalool or myrcene and things like that. And again, you can get all of those terpenes outside of cannabis. So if you can't find them there, definitely be sure to check them out, and see if you can find them in other places. All right, so listen to your body, adjust as necessary. Everything works synergistically to provide target effects. So just understand that you need to listen to your body, you need to be willing to experiment, and you need to work with your care team. So here are some sources if you wanted to check them out. We do have this presentation in PDF form, so if you want that, just let us know, and we will send that over to you. So hopefully this is a good starting point for you, and you can go and do some more research. This is just a beginning list. There are a lot of terpenes, there are a lot of cannabinoids, and a lot more things to explore when you have cancer. So hopefully this will give you a good starting point of information you can take back to your healthcare team, and good luck. If you have any questions, feel free to email us or go to our Facebook page. Thank you so much.